Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're trying something a little different here.
Say no more.
Yeah, we're mixing things up here a little bit.
All
We're
right.
doing a video in partnership with a company, which, by the way, I really like because they're a family-owned company.
Sure.
I always like that.
You bet.
Being that, we're kind of a family-owned company too, right?
Right, grassroots. We started from the bottom, and that's where we're
Build up,
moving up.
So this company is called Thermatex, and they're out of Canada, Calgary, Alberta.
Yeah.
Which, by the way, my kids used to go up there for band. They had the
sure.
Calgary Stampede, I believe it's
Right.
called. So, anyway, they have a whole line of products. They're infrared wave or infrared therapy or infrared heat products.
Right.
And they have products, Brad, believe it or not, they have them for humans, but they also have them for equine, which is horses, right?
Horses, yep.
And then also some small pets.
Sure.
So dogs and cats, and so.
So I fit in the mix.
Yeah, that's right. And we got something for you now. But the line of products that we're going to talk about today are for humans.
Sure.
And we're going to show you just some of them, but we're going to really concentrate on one at this time. So they have them for the different body parts, and we're going to talk about infrared in a minute here. Just stick with us here.
Sure.
So the title of our program is Can Infrared Heat Provide You with Pain Relief, and is it better than regular heat?
So we're talking about heat, we're talking about hot packs.
Right.
Right, the hot packs that you can buy and plug in, or, we use them, you can put them in the microwave. They sell them at the store. You put them in the microwave and you
or
put them
moist
in your
heat,
Moist heat.
which we use, that we actually have hot pack machines.
Right, in the therapy department.
In the therapy department.
Mm-hmm.
When I was in therapy too, in school, they also told us about radiant heat.
Sure.
Do you remember we used to use lamps? I don't know, maybe that was before your time.
Yeah.
But with all of them, I was told the same thing. It's very superficial. They're all the same.
In other words, they don't go very deep.
No,
to
they
the
don't
skin,
go very deep.
2 to 3 millimeters.
Right,
It
is all.
Just past the skin. You're not going to get into the muscle belly.
Right. And that's the advantage of the infrared heat.
Right.
It actually can penetrate up to 60 millimeters, which is 20 to 30 times more than regular heat.
Than just that moist hot pack even, or the regular outlet hot pack.
Hot pack, yeah. To me, this is a huge advantage because it's going to start getting into the joints.
Right.
It's going to start getting into the area that needs to get the circulation.
So for you people in the United States.
Yeah, how far? Do the conversion,
Yeah,
Brad.
60 millimeters, 2.36 inches.
He just did that in his head.
Right.
Isn't that amazing?
Oh, that's not a problem.
What a genius.
For me. Exactly.
So we kind of skipped ahead to that, but that's the gist of why we like this product. Is it's going to go so much deeper, and with that, it's going to give you a much better chance of getting things better.
Right. It's kind of like when we use ultrasound in the clinic. That
Right.
is a source of deep heat. But to get an ultrasound, it's awkward to use. It's expensive. This is
It's more of a professional device.
Right. This is for home use.
Right. So they've got products that pretty much cover every body part.
Sure.
This one here is actually for the knee, right, Brad?
Yeah. But get out of the way, Bob.
Well,
They got
sorry, Brad's trying to display them here.
Yeah.
So, and again, we're not going to go into detail on these right now. This one is for the feet, which is kind of cool. You slip your feet in. I think they call it the big slipper or the big foot. So I don't know.
Well, whatever. It's it's large enough to get both feet in there at the same time.
And these are different wrist ones, for right wrist, left wrist, and we'll have to show you eventually. That's going to be another video.
Right.
They also have a big one, Brad, that's just for the back, really, or the big muscles.
Right.
So, but this is their best seller, and this is the platinum one.
Okay.
The platinum system, and it's got 3 panels. And the first thing you're going to notice is these panels are real hard. They don't mold to the body.
Right.
And there's a reason for that. They have coils in there that they aren't supposed to bend.
Right.
So
they're a
protecting
little
the coils.
flexible. It's not like you're hard like a rock. There's
No, they're
flex.
comfortable. I'm not implying that they're not comfortable. But the other thing you need to know about infrared is that this does not necessarily need to conform right to the body in order to get the benefit. So, for example, if you turn around, Brad, or go to the side like that, yeah. Now, if I'm like this, and this isn't, even though this isn't touching his neck, the waves are going to penetrate into the neck nonetheless.
Right, you're still going to get the benefits. It's going to go deep. Boy, I can feel it right there.
You can feel it already.
Yeah, we have this plugged in, and it's ready to go right now. It usually takes 10 minutes for it to heat up, they recommend.
And I have found that it did take about 10 minutes.
Sure. Yeah.
My wife and I have been trading off at night using this.
Right.
So we for our various ailments. So she's having trouble with a hamstring injury, and so she's been using it on her butt. And I just, you know, the regular tension, stress of working with you, Brad.
Right, there is issues with me.
So I have to do that. But let's talk about some of the things where you really shouldn't use it, Brad. This has been found to be very safe, by the way.
Right.
I did the research on this. I went onto PubMed, and they said that there's really no downfall to using this. I mean, there's no downside at all.
Right.
But there are certain diagnoses that we want you to be careful with, as always.
We call them contraindications in the therapy world.
So, you want to name one?
Sure. If you're pregnant, you're not going to use it around.
We're always worried about pregnant women.
Right.
I mean, I imagine you could use it on your legs or maybe up here, but I'd want to stay away from it.
We just stay safe than store. Yep.
Yeah. If you're hemophilic,
okay,
that's a blood disorder. If you have lupus, Addison's, or MS, a lot of excess heat is not recommended in those cases.
You don't run it around a pacemaker.
Right. Pacemaker is always a big one too. This one we're not so sure about. If you had like a knee replacement or a hip replacement,
If you have some hardware
in there, you know, because it does penetrate deep, it could heat it up. I'd be safe around it. I'd want to check with your doctor maybe on that one. I just want to go ahead and do that. You don't want to use it on infants.
Right.
There's certain medications you might have to ask your doctor about. I don't know what they are, but if they're heat sensitive in some way.
Well, for example, the patch. If you got the pain patches that go directly on your skin, you're not going to put this over the top of that pain patch.
Very good point.
Right.
And I'd even be any open sores or anything like that too. I'd be very careful with that.
So that still leaves 90% of the population.
That 90 to 95% of the population. Right. So what some conditions are it's good for? Really chronic pain.
Right.
When you're trying to help manage pain like that, this is a great thing for that.
Exactly.
Because
if you've got a back problem that you just injured 2 hours ago and it's all flared up, that's not the time to put heat on it. This is a backache that's been going on for a week or two or even months. That's when we want to do this to increase the circulation and promote healing.
Really, I think it really works well with arthritis. Because arthritis is a condition where it's not going to go away to any large extent, but you have to manage it. And so this is a good management system for that. And we're going to show you how you can go all the way through. But tendonitis, bursitis, again, chronic pain, neck pain, back pain, fibromyalgia, another good one. Yeah. Again, you're trying to manage the pain.
Right.
So let's go ahead and start, Brad. Huh?
Sure.
I'm going to show the unique way I put it on my neck.
Okay.
So you're going to help me though. Because, by the way, you always want to make sure the cord is, coming away from you.
Right.
Do you want to talk about the cord, Brad, once?
No, let's start putting it on.
Okay,
I'll start talking
then you'll
about
talk.
It. Yeah, I just want to say this is well built. This is not chintzy built. It's the cord literally is hospital grade. It's really a nice cord, as well as the material. Yeah, and the material that this is made out of, you can tell it's going to last.
Both my wife and I were able to use this without having to get an extension cord.
Sure.
It went to my chair and it went to her couch.
Sure.
Now this is my technique. I'm going to call this the shrub technique.
Sure.
Where I wanted to get it up in the upper thoracic spine and maybe a little bit in the neck. So I went around, and it has a long strap and a short strap. And I went around and I strapped it in like this and held it off on the one arm. Then I could lean back in my chair.
And the chair presses against it to add
it
some more conduction there.
And a lot of times, if you're laying in a chair that you can go all the way back and lean your head against, then you're not going to need to do this. You can just put it back and lean against it. But I'm tall, so I have trouble with that.
Right.
So
sure.
Why don't you unstrap it, Brad, and then I'm going to show you how you can just lay down too. If you're in bed, I would put it actually like this.
Okay.
And for your neck, I even put a little rolled towel there.
You bet.
And you can go like this, and now it's going to go right into the, again, it doesn't need to conform, but this way it goes right into the gap of the neck, and this is really comfortable, Brad.
Sure.
Oh, the heat feels good.
Right. So it is nice to maintain a good, comfortable, relaxed posture along with the heat, so that you're relaxed and allows the muscles to even relax more. The heat, the deep heat is going to help the circulation, which is going to promote the healing, help being relaxed.
It's going to definitely give you some temporary relief from pain. Now, if you want to go on and get some permanent relief from pain, then you're going to want to do some exercises along with this.
Right.
And what Brad I have found, let's hit the next one first. Why don't you put it on my shoulder, Brad?
Yeah.
We can just You can go like you can just put it right up like this and strap it on. Short strap or long strap.
Okay.
Now, what Brad and I have found is that a lot of times people, like when they have arthritis or a joint problem, it hurts so much they don't do anything. You know,
Right.
they stop moving.
Right.
And that's the worst thing that you can do. So this, what you can do with this is go ahead and put this on, get the circulation going, get the pain level down, and then you can start doing the rotations or the range of motion that you need to do to get things moving.
Right. So if it's your shoulder, it might be something as simple as hands together and getting some
Or
flexion.
yeah, working the extension like this.
Right.
I mean, there's a whole lot of, we have a lot of videos on this. We're going to probably go more into this in some future videos
Sure.
on this. All right, why don't we do the back one, Brad? I'm going to go ahead and we'll do it on my shirt because you can see. Lonnie, you got me yet? When I stand up, she loses me sometimes.
No, we don't, it's just your head, so we don't need to look at that face. All right. So,
Now, obviously, you can just lay on this too.
right.
I mean,
Or when you sit down in a chair, put it there and relax. But here, it does work so that obviously you're not going to get up and vacuum with this, but it does allow you to get up and down and it stays where it needs to.
yeah, it gives you a little mobility. If you have one of those sit-to-stand chairs, desks,
Right.
you know, you could actually get up and go down
Right.
with
So,
this in
right.
place.
If you're working at the computer,
Yeah, it really
when
gives
you're
you
not-
mobility.
Right, so you can move around a little bit. You know, just laying back down on there, Bob. You know, like here.
Oh, right.
Obviously, in that situation, you don't need the strap. but
Right.
You can put it on to hold it there.
But I
if
can
you're
get
gonna move.
up, I can get down, I can keep it on all around.
Right.
So-
there you go.
All right, let's do the elbow on this one. So you got the short strap?
Yep, just put it on, Bob.
Oh, just put it on right
Yep.
now.
Yep.
We'll make a circle, Brad, and just use this.
Yeah, I'll get it. Put it on
Okay.
your elbow. They do have
Okay.
two different length straps, but the long one works just as good as far as I'm concerned.
You can go around a couple times and
Yeah.
really get it in place then. So again, you know, when you think about it, 2.36 inches, it's going through the joint, Brad.
Right.
You know what I mean?
You've 2 it's wrapped around, so your whole arm is getting warmed up. Now this is not going to heat it up to where your blood's going to boil.
No.
It's 36 watts, which is not
It's
very
really
much.
comfortable, and that's a good point, Brad. You just hit the switch and it turn it on. There's no
Right.
little rheostat or anything like that.
Exactly.
It just works out
and
real well.
it is not one of those things where it's like, oh, if you leave it on for a half hour, it's going to be too hot. I mean, I would feel comfortable falling asleep with this and not burning myself.
Right. Now you can put it into a muff.
There
like
you
this,
go.
Get the hands.
Mhm.
You can go ahead and this is how my wife is using it. You can just go ahead and use it on your butt because she's having a hamstring issue.
Sure.
So you can just go ahead and lay on it like that, and
Yep.
she's getting, you know,
If
again
you got
where
a
the hamstring.
tight piriformis causing some
Piriformis
sciatica.
muscle, yep. If you go down into the quadricep or hamstring issues, you know, to lower hamstring, you can
That.
go, I get the hamstring that way,
It is perfect for that.
I can get the quad that
Yep,
way.
you can wrap it around.
And obviously the same with the knee.
Knee,
You
yep,
gotta go,
calf muscle.
and again, if I put it on top, it's pretty much between this panel and this panel, it's going through.
Right,
I mean,
yep, you're getting
so,
a good,
very good for plantar fasciitis too. I mean, you can just go ahead and put your foot on it.
Right.
And what I like about that then is it's gonna heat it up, and then you can stretch it.
pull that shoe off, Bob. The bottom panel gets the bottom of the foot and it wraps around. It really is a full wrap.
Yeah.
Very
So
nice.
yeah, this actually is really comfortable. I haven't tried that yet, and I haven't tried the big slipper yet.
Sure.
So, what Thermatex is doing, Brad, they're giving a trial offer here. This is a pricey device.
Mm-hmm.
I mean, but my guess is, that, you know, once you have it, you're going to use it daily, and that is what their recommendation is that you use it. If you're having a problem, you're supposed to use it twice a day for 30 to 45 minutes.
And there is a scientific study. I read the scientific study. It's done well, and it's showing benefits for
Of
people
doing it that long.
up to 4 weeks. Yep.
Right. Now, you don't need to do that forever. They're recommending that for 10 to 14 days. And then after that, you can drop down to once.
Sure.
Now, you may think, how am I going to spend that much time doing this? But you can do it while you're watching TV, or a lot of times even while you're working.
Right.
So, I mean, that's why I think it's doable that you
Right.
can do those
You
amounts.
just need to be a little creative, and you'll be amazed.
But they do have a trial offer. It's normally $249, but if you hit the link below, it's going to be for $219.
Right.
So they're going to give you $30
And
off.
if you're taking pain meds or some other meds, and you're paying, you know how fast some of those drug costs can be, and this is going to last years versus
Right.
one use of the medication.
Yep. So, you know, give it a shot. And if you want more information, I think you can hit that link below too, and it'll give you more information
Sure.
at Thermatex. And remember, Brad and I can fix just about anything.
But that broken heart, but this could be,
This might be doing it.
We can start doing a study with this on that. Maybe it'll,
We are working on it. Thanks a lot.
take care.